Now we'll take a look at sleep disorders. Insomnia is the inability to sleep or obtain quality sleep, and unfortunately for most of us, it can shorten the lifespan. But the relationship between the amount of sleep and its effects on health are really kind of interesting. If we sleep less than 6 hours, that is associated with a shortening of the lifespan. But sleeping more than 8.5 hours a night is about as bad as sleeping fewer than 4.5 hours. So sleeping too little is harmful, apparently, and sleeping too much is also harmful. It may contribute to obesity, and it is also, not surprisingly, affected by stress. It is common in people with psychological disorders to have insomnia, to suffer from insomnia, especially affective disorders like depression. Now, interestingly, it can be caused by exposure to blue light. So if you are on your phone or some other device until late at night, that can be problematic for sleep. Exposure to those shorter wavelengths of light at night sends a signal to your suprachiasmatic nucleus, right? That there's still light out there. And so it can make it hard to fall asleep because the signals for getting tired at night and feeling sleepy, the darkness, is really absent. And it turns out that in particular, those short wavelengths that we call blue light are the ones that most affect the sleep-wake cycle. Now we'll take a look at some of the problems associated with drug treatment for sleep disorders like Ambien and Lunesta, those two commonly used drugs for sleep problems. They can be addictive and they have significant side effects like memory loss. Some people report sleepwalking and even sleep driving while under the influence of Ambien and Lunesta. And so you can see here, there's even this cute cartoon about the Ambien walrus. Come with me on an adventure you'll never remember because of its known impairments to memory, as well as the idea that there can be these sort of nocturnal adventures that people have that they will not be aware of and remember later on. It can also lead to a reversible form of dementia in the elderly, so these drugs are not going to be recommended for older individuals either. So there really are no particularly great drug therapies for individuals who have a lot of trouble with insomnia and need to take something basically every day. One cause of insomnia is tied to our circadian phase being a little bit desynchronized. And so remember, our circadian rhythm includes not just that we're awake or asleep, but also other systems in our body like body temperature, blood pressure, and so on. And so we kind of want all of these things to be in sync together. And so if we look here at figure 15.13, we can see that during the normal sleep period, when this individual is in bed, their body temperature is dropping when they go to bed, and that's going to facilitate falling asleep. And in the morning then, when it's time to wake up, notice that their body temperature is rising. So falling body temperature is conducive to sleep, and then a rising body temperature is conducive for waking up. Here, in this case, in B, we can see that there is a phase delay. And so peak body temperature doesn't seem to happen until 7:30 at night, just about, in this individual's case. And so when they go to sleep, they go to bed, their body temperature is still quite high, making it difficult for them to fall asleep. And so this is going to make it hard for individuals to fall asleep. So that will create what's called onset insomnia. And then we can see here that in condition C, the temperature of the body is dropping too early. So this is a 4-hour phase advance. And so when they go to sleep, their body temperature is already sort of at a peak low level and starts rising before they're ready to wake up. And so this makes the person wake up earlier than they should and can limit their amount of sleep as a result of that.